Most men believe discomfort is just part of aging. Wrong. That silence could cost you years of your life. The symptoms your body whispers today become the disease that screams tomorrow. Prostate cancer strikes 1 in 8 men, yet we ignore the warnings, trapped in a dangerous masculine stoicism. Prostate cancer early symptoms you should never ignore isn't just medical advice, it's your roadmap to survival. Pain when urinating isn't normal. Frequent nighttime bathroom trips aren't just getting older. These are signals. Your body is speaking. Will you listen? The responsibility to act is yours alone. No one else can save you from what you refuse to face. Number 1, frequent urination. I once counseled a retired judge, 74 years old, brilliant legal mind, who dismissed his increasingly frequent bathroom trips as just getting older. 3 months of disturbed sleep, planning outings around bathroom access, and avoiding long car rides. When his son finally convinced him to see a doctor, the early-stage prostate cancer diagnosis shocked him. I thought it was normal, he told me, his voice tight with regret. I thought inconvenience was the price of aging. This dismissal reveals something profound about how men relate to their bodies after 60. We develop a peculiar form of mind-body dualism, treating the physical vessel as something separate that naturally deteriorates while the mind remains sharp. This Cartesian split becomes a psychological defense mechanism. By normalizing dysfunction, we protect ourselves from confronting mortality. The judge's experience transformed when he kept a simple journal tracking his urination patterns. Morning, afternoon, evening, night, tallying frequency created an objective distance from the symptom. This wasn't about anxiety or hypochondria, it was data collection. The pattern revealed itself 11 times daily, 3 times nightly. The numbers spoke with an authority his subjective experience couldn't match. Frequent urination isn't merely inconvenient, it's information. Your body communicates through patterns, and this particular signal, the need to urinate more than 8 times daily, or multiple times nightly, deserves your full attention, not because it's cancer, but because ignoring the signal surrenders your agency in what happens next. Number 2, weak urine stream. A CEO I worked with built a manufacturing empire from nothing, negotiated billion-dollar deals, and found himself unable to discuss the progressive weakening of his urine stream with anyone, even his physician of 30 years. This intimate vulnerability paralyzed the man who fearlessly faced corporate raiders and market collapses. This reluctance stems from what Jung called the shadow, the disowned aspects of ourselves that threaten our conscious identity. For many accomplished men, physical vulnerability represents the ultimate shadow element. The successful male identity in Western culture is constructed around strength, virility, and control. When the body begins functioning unpredictably, it threatens not just health, but identity itself. The CEO's breakthrough came through a reframing I suggested, viewing his body as the most important corporation he would ever manage. A faltering system required investigation, not shame. He began methodically monitoring stream strength, noting decreased force and intermittent stopping and starting. This objective framework allowed him to approach his doctor with the same analytical precision he'd apply to a struggling division in his company. A weakening stream represents a message, not a failure. When the flow becomes hesitant, interrupted, or takes longer to empty the bladder, your body is communicating valuable information. This isn't about embarrassment, it's about intelligence gathering. Number 3, difficulty starting urination. An architect I treated, who designed structures that transformed city skylines, found himself standing at urinals, unable to begin the flow despite urgent need. The physical strain, the psychological humiliation in public restrooms, and the growing anxiety each time he needed to go. I feel betrayed by my own body, he confessed. This experience represents a profound psychological truth. Control is largely an illusion we maintain until our bodies demonstrate otherwise. The architect's professional life centered around precision and mastery, making this loss of basic function existentially threatening. It wasn't just physical discomfort, it was a fundamental challenge to his sense of self. His path forward began with acknowledgement. Rather than continuing to pretend everything was normal, he started scheduling specific bathroom times regardless of urge, creating 5-minute windows throughout his day. This preemptive approach reduced performance anxiety. He would sit rather than stand, using relaxation techniques he'd previously dismissed as new age nonsense to release pelvic tension. difficulty initiating urination, that hesitation before flow begins, the straining, the feeling of incomplete emptying signals a mechanical obstruction. The prostate gland encircles the urethra like a collar, and as it enlarges, whether benignly or malignantly, it constricts this passageway. Your difficulty is meaningful data about what's happening beneath conscious awareness. Each of these symptoms, frequency, weak stream, difficulty starting, represents not just physical discomfort, but critical information that demands your response. The masculine capacity for stoic endurance becomes your enemy here. What's required isn't fortitude but attention, not strength but awareness. Your remaining years depend not on what you can endure, but on what you're willing to acknowledge. Number 4, pelvic discomfort. I worked with a retired military officer, 40 years of service, decorated combat veteran, who dismissed the persistent ache in his lower pelvis as just another old war injury acting up. For 6 months he swallowed over-the-counter pain relievers rather than investigate the true source. When finally diagnosed with prostate cancer, he realized he'd been fighting the wrong enemy all along. This tendency to misattribute symptoms reflects a deeper psychological mechanism, what psychologists call confirmation bias. We interpret new information to confirm existing beliefs. A military man attributes pain to old injuries. A former athlete blames sports trauma. A desk worker suspects poor posture. These explanatory frameworks feel comforting, but become deadly when they prevent accurate assessment. The officer's transformation began when his wife suggested a simple daily pain journal: location, intensity, triggers, duration. The objective record revealed what his subjective experience obscured. The discomfort had nothing to do with physical exertion or old injuries. It was constant, centered in the lower pelvis, occasionally radiating outward. The pattern spoke with unmistakable clarity once properly documented. Pelvic discomfort doesn't announce itself dramatically. It arrives as a dull ache, a feeling of pressure, a persistent heaviness in the region between your hips. The subtle nature of this symptom makes it particularly dangerous. It doesn't disable you, it merely diminishes you incrementally, becoming the background noise of your existence until you forget what comfort felt like. Number 5, back or hip pain. A professor emeritus I counseled, internationally renowned historian, had suffered progressive lower back and hip pain for nearly a year before seeking help. I assumed it was the natural tax of aging, he told me, the price we pay for remaining upright all these decades. By the time he received a proper diagnosis, the cancer had metastasized to his bones. This narrative of inevitable physical decline represents a particular danger for intellectually accomplished men. Having defined themselves through mental capacity, they often develop a dismissive relationship with their bodies, treating physical symptoms as mere distractions from more important work. This mind-body dualism becomes particularly dangerous after 60, when bodily signals require more, not less, attention. The historian's approach changed when a colleague suggested framing his symptoms as historical evidence requiring interpretation. He began documenting the pain's qualities: dull, persistent, worse at night, unresponsive to position changes, treating these characteristics with the same analytical rigor he'd apply to historical documents. The pattern that emerged pointed away from mechanical back problems towards something systemic. Back and hip pain related to prostate issues has distinctive qualities. It tends to be deeper, more persistent, often worse at night, and unresponsive to the position changes that typically relieve mechanical pain. When your body communicates through this particular dialect of discomfort, it's speaking about more than muscle strain or joint wear. Number 6, pain during ejaculation. A successful entrepreneur, I treated, built, and sold 3 technology companies and found himself experiencing sharp pain during ejaculation. Despite an otherwise active sex life, he avoided discussing this symptom with anyone for nearly 8 months. It seemed too personal, he explained, too fundamentally private to share even with my doctor. This silence surrounding sexual symptoms reflects a profound cultural paradox. Western society simultaneously hypersexualizes and desexualizes men over 60, expecting continued virility while making it taboo to discuss actual sexual function. This contradictory positioning creates a perfect blind spot where critical symptoms hide in plain sight, masked by shame and cultural discomfort. The entrepreneur's turning point came through an anonymous online medical forum. Reading other men's accounts of similar symptoms broke his isolation and contextualized his experience. He created a detailed symptom log, noting intensity, duration, and associated factors. This objective framework allowed him to transcend embarrassment and approach his physician with the same matter-of-fact clarity he'd used to discuss any other bodily function. Pain during ejaculation isn't merely a sexual inconvenience, it's information about what's happening in the reproductive tract. This symptom often indicates inflammation or obstruction in the ejaculatory ducts or prostate. When sexual climax brings sharp pain rather than pleasure, your body is sending a specific and urgent message about dysfunction in this system. Each of these symptoms, pelvic discomfort, back or hip pain, painful ejaculation, represents your body's attempt to communicate about potential threats to your continued existence. The stoicism that served you well in your professional life becomes actively dangerous here. The psychological strength that helped you endure difficult challenges must now be redirected toward acknowledgement and action rather than endurance. What's at stake transcends mere physical comfort. These symptoms, properly interpreted, represent your opportunity to maintain authority over your remaining years, to determine whether they will be lived with vitality or surrendered to preventable decline. Your body speaks in the only language available to it. The question is whether you've developed the capacity to listen with the same intensity you once applied to professional challenges. Number 7, blood in urine. I remember a distinguished attorney I counseled 40 years arguing landmark cases, respected by the highest courts, who noticed faint pink discoloration in his urine one morning. He dismissed it as a fluke, avoided fluids that day to prevent further observation, and told no one for 3 weeks until it happened again. His reluctance nearly cost him his life. This avoidance represents a profound psychological pattern, what therapists call experiential avoidance. It's the human tendency to suppress or escape uncomfortable internal experiences, even when doing so causes long-term harm. For men who've built identities around control and competence, blood and bodily fluids represents a particularly threatening loss of bodily integrity. The impulse to look away becomes almost irresistible. The attorney's transformation began when his wife, noticing his increased bathroom anxiety, directly asked what was wrong. Breaking his silence created accountability. Together they developed a simple protocol, a small notebook beside the toilet, white paper in the bowl before urination to improve visibility, and objective documentation of any discoloration. This systematic approach transformed frightening symptoms into manageable data. Blood in urine, whether visible pink or red discoloration, or microscopic amounts detected only through testing, represents your body breaching a fundamental boundary. Urinary tract vessels don't release blood under normal circumstances. This symptom, technically called hematuria, demands immediate attention not because it's definitely cancer, but because it's abnormal and potentially significant. Number 8. Blood in semen. A university professor I worked with, a respected mathematician, married for 40 years, experienced rust-colored semen during intimacy with his wife. His immediate response was profound shame. Rather than seek answers, he began avoiding sexual relations entirely, creating distance in his marriage precisely when connection mattered most. 6 months of silence followed before his wife insisted on answers. This reaction reveals something essential about masculine psychology. For many men, sexual function is intertwined with core identity in ways that make dysfunction feel like fundamental failure. This isn't merely embarrassment, it's an existential threat. When sexual symptoms emerge, many men instinctively protect their self-concept through avoidance rather than confront potential limitations. The mathematician's pathway forward began with information seeking, something his analytical mind could embrace. Reading medical literature normalized his experience, placing it in the context of prostate conditions. He and his wife developed a matter-of-fact approach to monitoring changes, removing the emotional charge through objective documentation. This transformed isolation into partnership. Blood in semen appearing as pinkish, rust-colored, or reddish discoloration represents disruption in the reproductive tract. Though often caused by inflammation or infection, it nevertheless warrants investigation as a potential indicator of prostate issues. This symptom carries particular psychological weight because it emerges in intimacy, when vulnerability is already heightened. Number 9. Unexplained weight loss. A retired business executive in my practice built a nationwide retail chain from a single store, lost 18 pounds over 3 months without changing his diet or activity level. He initially welcomed this as finally getting back in shape despite not trying. When his clothes began hanging off his frame, his daughter insisted on a medical evaluation. The diagnosis was advanced prostate cancer with metastasis. This misinterpretation demonstrates a dangerous cognitive error, attributing positive meaning to objectively concerning changes. Psychologists call this motivated reasoning, processing information to reach comforting rather than accurate conclusions. Unexpected weight loss feels like a gift rather than a warning, particularly for men who've struggled with weight in middle age. This interpretive error creates precious time for disease progression. The executive's perspective shifted when his daughter created a weekly weight chart documenting the steady decline alongside food intake records. The objective data revealed what subjective experience obscured: his body was consuming itself despite adequate nutrition. This pattern spoke clearly of metabolic disruption that required explanation. Unexplained weight loss, particularly a drop exceeding 5% of body weight over 12 months without intentional dieting or increased exercise, signals that something fundamental has changed in your metabolic balance. Cancer cells demand extraordinary energy, essentially hijacking your nutritional intake and even consuming your tissue reserves to fuel their proliferation. Each of these symptoms, blood in urine, blood in semen, unexplained weight loss, represents a significant boundary crossing in your body's normal functioning. They aren't subtle hints, they're alarm bells. What makes them dangerous isn't their subtlety, but our remarkable capacity for denial. The psychological mechanisms that helped you manage anxiety throughout your career become active liabilities when they prevent an appropriate response to legitimate threats. What's required isn't fearfulness but clarity, not anxiety but attention. Your body operates according to established patterns. When those patterns change significantly, the message isn't ambiguous. It requires the same level of serious consideration you would give to any other existential challenge. Your remaining years depend not on what you're willing to endure, but on what you're willing to see clearly. Number 10. Erectile dysfunction as a warning sign. I counseled a retired airline pilot, 35 years commanding international flights, perfect safety record, who experienced progressive erectile difficulty over 6 months. Instead of seeking medical evaluation, he silently obtained prescription enhancement medications online, treating the symptom while ignoring its potential significance. This decision nearly cost him years of life. This pattern reveals something profound about male psychology. For many men, sexual function is so fundamentally intertwined with identity that dysfunction becomes something to hide rather than investigate. This isn't mere vanity, it's existential protection. What many don't realize is that erectile difficulties can be the proverbial canary in the coal mine, signaling vascular problems, or sometimes prostate issues, including cancer. The pilot's transformation began when his prescribing physician finally asked the right question: when did this start, and what else has changed? This simple inquiry contextualized the symptom, placing it in a timeline of bodily changes rather than treating it as an isolated malfunction. The comprehensive evaluation that followed revealed early-stage prostate cancer with excellent treatment prospects. Erectile dysfunction that develops gradually over months, particularly when accompanied by other urinary symptoms, warrants investigation as a potential indicator of prostate issues. This isn't about sexual performance anxiety or relationship issues. It's about vascular and hormonal changes that may connect to underlying pathology. When this particular function changes significantly after decades of reliability, your body is sending specific information. Number 11. Bone pain in advanced cases. A distinguished professor emeritus, I treated a globally respected philosopher, developed persistent pain in his ribs, lower back, and pelvis. For nearly 7 months, he attributed this to aging joints and increased his pain medications rather than investigating further. When finally diagnosed, the prostate cancer had already metastasized extensively to his skeletal system. This misattribution exemplifies a dangerous psychological pattern, the normalization of decline. After 60, many men develop an explanatory framework that automatically attributes new symptoms to just getting older. This fatalistic perspective serves a psychological function, reducing anxiety by suggesting nothing can be done, but creates devastating medical consequences when treatable conditions progress unchecked. The philosopher's approach changed radically when a colleague suggested framing his symptoms as an intellectual problem, requiring investigation rather than an inevitable burden to be endured. He began documenting pain patterns with philosophical precision: location, quality, triggers, response to interventions. The emerging data revealed what subjective experience had obscured: This wasn't mechanical joint pain, but something systemic and progressive. Bone pain related to prostate cancer has distinctive qualities. It tends to be constant, often worse at night, and typically affects the ribs, spine, pelvis, and femurs where metastases commonly appear. These characteristics distinguish it from typical arthritic or mechanical pain. When discomfort in these areas develops and persists, particularly if it's unresponsive to position changes and conventional pain management, your body is communicating about something beyond normal musculoskeletal aging. Number 12, swelling in legs or pelvic area. A retired judge I counseled, respected for his penetrating intellect on the federal bench, noticed progressive swelling in his legs and pelvic region. For nearly 2 months, he attributed this to heart problems, modified his salt intake, and elevated his legs without seeking medical evaluation. The actual cause was advanced prostate cancer obstructing his lymphatic system. This misdiagnosis reflects a common cognitive error psychologists call availability bias, the tendency to explain new information based on what's most readily available in our knowledge or experience. A man with a family history of heart disease naturally attributes swelling to cardiac issues. Someone with kidney problems assumes renal causes. These explanatory shortcuts provide false comfort while the disease progresses. The judge's perspective shifted when his son, a mechanical engineer, made a simple observation: the human body is a system of flows. When a flow is blocked, pressure builds upstream. This hydraulic metaphor clarified the symptom. The judge began tracking swelling patterns with judicial precision, measuring leg circumference daily, documenting the time course, and noting what improved or worsened the condition. The systematic pattern revealed lymphatic obstruction that required explanation. Swelling in the legs or pelvic area, particularly when persistent or progressive, may indicate lymphatic obstruction from enlarged pelvic lymph nodes. This symptom often appears in more advanced prostate cases when cancer has spread beyond the prostate itself. The gradual nature of this symptom makes it particularly dangerous. The incremental changes can be normalized or misattributed until significant disease progression has occurred. Each of these symptoms, erectile dysfunction, bone pain, swelling, represents your body's increasingly urgent attempts to communicate. What makes them particularly dangerous isn't their subtlety, but their susceptibility to misinterpretation through the psychological filters we develop with age. The explanatory frameworks that helped you make sense of the world throughout your life become dangerous when they prevent accurate assessment of bodily signals. What's at stake isn't merely comfort but sovereignty, your ability to make informed choices about your remaining years. The stoicism that served you in building careers and leading organizations becomes actively harmful when it prevents an appropriate response to legitimate threats. Your body speaks with increasing urgency as threats escalate. The fundamental question is whether your interpretive framework allows you to hear the message accurately before critical decision points have passed. Number 13, when to see your doctor. I counseled a distinguished professor, a renowned historian, author of 15 books, who noticed subtle changes in urination patterns for nearly 8 months before seeking evaluation. His reluctance wasn't fear, but something more insidious: the belief that his time was too valuable to waste on medical appointments when he had one final book to complete. The advanced diagnosis that followed shattered not just his health, but his ability to finish his life's work. This prioritization error reflects something profound about accomplished men: the tendency to view the body as merely instrumental, a vehicle for the mind's work, rather than an integrated aspect of the self requiring its attention. This Cartesian dualism becomes particularly dangerous after 60, when bodies require more, not less, attentive maintenance. The historian's perspective transformed when his physician asked a simple question: what are you preserving your time for, if not for more time itself? This clarified the fundamental calculus. He developed a structured approach to symptoms. Any urinary change lasting more than 2 weeks warranted investigation. This boundary created clarity amid the ambiguity of subtle symptoms. The timing for medical evaluation isn't complex. Any urinary symptom that persists beyond 2 weeks deserves professional assessment. This isn't about catastrophizing every bodily variation. It's about respecting the distinction between transient fluctuations and persistent patterns. When your body deviates from established functioning for more than a brief period, it's communicating something that merits attention. Number 14, screening options and frequency. A business executive in my practice, CEO of a multinational corporation, prided himself on efficiency, optimizing every aspect of his schedule. Yet he applied this precision everywhere except his medical care, which remained reactive rather than proactive. No regular screenings, no PSA monitoring, no digital rectal exams. His diagnosis came only after symptoms became impossible to ignore. This pattern reveals a particular psychological blind spot, what behavioral economists call hyperbolic discounting, our tendency to minimize future benefits in favor of present comfort. The discomfort or inconvenience of screening today outweighs the theoretical benefit of early detection tomorrow. This temporal distortion becomes increasingly dangerous as cancer risk rises with age. The executive's transformation followed a sobering statistical briefing from his personal physician. Understanding the concrete risk numbers, 1 in 8 men diagnosed in their lifetime, with risk increasing substantially after 65, recalibrated his cost-benefit analysis. He developed a structured screening protocol with calendar reminders treated with the same inviolability as board meetings. Prostate screening isn't complicated but requires consistency. After 50 or earlier with family history or African American heritage, regular PSA blood testing and physical examinations should be scheduled according to your physician's recommended intervals. This isn't about fear or hypervigilance, it's about establishing an information baseline that makes changes detectable when they occur. Number 15. Conversations to have with your doctor. A retired military officer I worked with, a combat veteran, Bronze Star recipient, found himself unable to articulate his symptoms clearly during medical appointments. Faced with limited appointment time and complex bodily changes, he would minimize symptoms, speak vaguely, or forget critical details entirely. This communication failure delayed his diagnosis by nearly a year. This difficulty stems from a deeper pattern, what communication theorists call context-dependent communication skills. Men who communicated effectively throughout their professional careers often struggle when discussing intimate bodily functions. The vocabulary feels foreign, the subject matter uncomfortably personal. This linguistic limitation becomes medically dangerous when it prevents accurate information exchange. The officer's approach improved dramatically when he implemented a pre-appointment protocol, a written symptom journal with specific entries for frequency, duration, intensity, and impact on daily function. This documentation transformed vague subjective experiences into clear data points he could reference during time-limited medical encounters. Effective communication with healthcare providers isn't intuitive, it's a learnable skill. Before appointments, document specific symptoms with objective metrics where possible. Prepare explicit questions about screening recommendations, risk factors, and what changes would warrant urgent evaluation. Clarify what follow-up should look like and how you'll receive results. This structured approach transcends both stoic minimization and anxious exaggeration. Each of these action areas, timely evaluation, regular screening, effective communication, represents the practical application of psychological insight. The capacity for denial that may have served you in navigating life's challenges becomes actively dangerous when it prevents an appropriate medical response. The organizing skills that built your career can now be deployed to maintain your health with the same systematic rigor. What's ultimately at stake transcends mere longevity. It's about maintaining authority over your remaining years. Early detection of prostate issues doesn't merely extend life, it preserves life quality by expanding treatment options and reducing the need for more aggressive interventions. Your capacity to act on bodily information directly determines whether your future unfolds according to your choices or is dictated by disease progression that could have been addressed earlier. The responsibility for this vigilance rests entirely with you. No one, not your spouse, not your doctor, not your children, can monitor your bodily changes as intimately as you can. The choice between proactive awareness and passive hope isn't merely medical, it's existential. Your remaining years will be shaped by this fundamental decision. Will you apply the same rigor to maintaining your health that you once devoted to building your career? The symptoms we've discussed aren't merely medical curiosities, they're communications from the deepest biological systems that sustain your existence. Your response to these signals will determine not just the length of your remaining years, but their quality and meaning. The chaos that awaits the man who ignores his body's warnings is not just physical suffering, but the surrender of choice itself. When symptoms progress unchecked, options narrow, autonomy diminishes, and the future contracts around you. Order emerges not from denial but from the courageous confrontation with biological reality, the willingness to acknowledge vulnerability as the paradoxical path to maintaining strength. What separates the final chapter of a meaningful life from a tragic epilogue isn't luck, it's vigilance transformed into action. The same discipline and clarity that built your career, raised your family, and overcame life's challenges must now be directed toward this final essential responsibility. Ask yourself, will you be the author of your remaining years or merely their witness? The choice is still yours, but only while you have the wisdom to listen when your body speaks.